hear the word trauma, what comes to your mind? Loss, pain, depression, and other similar emotions, I assume. However, trauma is something that needs to be properly handled. And we all need to talk about this. So today on Catholic Faith Forum, I'm here with Mr. Chris Abojei, clinical psychologist and psychotherapist. And we're going to be talking about dealing with trauma. How are you today?
I'm doing well. Thanks for having me back.
Okay, you just seem so calm and collected, like nothing can trouble you.
Trauma.
Okay, you've heard that. When we come back from this break, we'll go into the gist of the day. Stay with us. Welcome back. This is Catholic Faith Forum. I'm May, and I'm here with Mr. Chris Abojei, and we're talking about dealing with trauma. So, where should we even start from? What is trauma?
Thank you. Trauma is a deeply distressing experience, and there are different forms of trauma. Experiencing an auto accident could be traumatic. So any experience that you have, however small or big, and it has nothing to do with the severity, that causes a deep distress to the individual, could be regarded as trauma.
Okay, is PTSD the same thing as trauma?
PTSD and trauma are different. PTSD is a response. It's post-traumatic stress disorder, and that's different from trauma itself. Like I said, trauma is that stressful, distressing experience. But when it comes to PTSD, we have to then look at duration. We have to look at the symptoms. We have to look at a lot of things. So PTSD, like we said, it's post a traumatic experience. So I've experienced something traumatic. Not everybody who experiences trauma develop PTSD. But some people do, and then it would come with symptoms, with flashbacks, re-experiencing that traumatic event. Re-experiencing it could affect sleep, could affect a lot of other things, emotional problems, even physical health problems, and affect relationship with God, affect a lot of areas of this individual life. But the key thing we need to take note of here is that PTSD usually affects a person's functioning. The ability to adapt and function well.
Okay, so what are there different types of trauma, and can you tell us about them?
Well, when it comes to types of trauma, we might want to look at it from duration, right?
Okay.
So we have probably acute, let's talk about acute trauma. And with that, you want to look at a duration within 1 month of experiencing this event. So symptoms that come up within 1 month are usually regarded as normal. And even in proper ethical treatments, you don't start therapy with someone who is experiencing acute trauma. You want to give that 1 month duration because the brain has the ability to heal itself. So when a person has experienced trauma, you want to give the person at least 1 month for the brain to try to, because the flashbacks, the nightmares are normal, given that circumstance, given that particular event.
Troubling situation.
Yes, but when it exceeds 1 month and this individual is not able to cope properly, then you want to look at PTSD in that case. It could also range from emotional trauma. It could range from physical, from emotional trauma, physical trauma, psychological, which of course would encompass emotional, and to make it a little bit light, financial trauma as well. and then with the news of coronavirus, and that also could be traumatic for some people and could lead to other psychological distress as well.
Can you give examples of the other types of trauma that you explained so that we can have a clearer picture of what we're talking about? Okay,
so I mentioned the acute trauma, and I mentioned the post-traumatic stress, and then I extended to talking about emotional trauma, which could come from relationships that were probably traumatic, physical trauma, psychological, academic. Again, the list is always endless when you start looking at it's more about classifying the source of the trauma. So when you talk about emotional trauma, we know that the source has to do with something emotional. When it's physical, the source has to be something physical, but it's classifying the source of the trauma, basically.
Okay, so who is to blame for this trauma?
So thank you for that question, because in my practice, I realized a lot of people come in with that problem of trying to blame themselves or blame the
There's a lot of
victim.
victim blaming going
Yes,
around.
blame the victim, blame themselves, blame the person who, you know, the
Oh,
perpetrators,
yeah.
blame God in some cases as well, especially when the trauma, the source of the trauma is probably a sexual abuse or a physical abuse. Then they want to blame God. Why me?
Why did you allow this
Why
happen?
do you allow this happen? Why? And they blame themselves. What could I have done differently? But when it comes to which to blame, I usually would say that there's no one to blame. And we shouldn't be talking about who's to blame. We shouldn't be trying to say who's at fault. What we should try to say is, how do I take responsibility? So it might not have been my fault, but I can take responsibility of what has happened because it's my life. And so if I allow myself keep on pointing the finger at God or keep on pointing the finger at somebody else, what I would find out is that I'll be stuck there, right? So my ability to take responsibility and do something about it is what we should be talking about. The symptoms people experience after a traumatic event,
experience.
most times, like I said, are normal given a certain range of time. And it has nothing to do with their own strengths. Because I've also noticed some people blame themselves because they think, oh, this happened to some other person and they are doing well. Why am I not able to do well? Why am I not able to bounce back? That means something is wrong with me. I've had clients constantly say that. And I like to tell them in therapy that that's usually the source of the problem. The fact that you think there's something wrong with you is actually the problem, not that there is something wrong with you. So when it comes to who is to blame, the victim is not to blame, God is not to blame. Maybe in our society, we might want to say, okay, the person who initiated this traumatic event, perpetrators could take some blame, but that's not the most important thing. The most important thing is saying, take responsibility and do something about this.
But in our society, you see this clear case of victim blaming going around, like a lady who has been raped and she was accused of dressing too shabbily or walking around along the street. And I think doesn't that add to the traumatic experience? Doesn't that add to the problems that this person is going to encounter?
It does, actually. In fact, in most cases, this becomes a certain type of borrowed voice, because when people begin to blame you and say, you should have done this, you should have done that, sometimes victims of trauma imagine what people would say. So what would my mom say? My mom would have said, why didn't I do this? And they take up this as a blame. And so it's not right to do that. This is because our society still don't understand that there's a difference between taking the blame and taking responsibility. They are two different things. And so because we're trying to make sure that this person does something about it, we blame them rather than help them take responsibility. So where we should be going is not to blame people. Where we should be going is, so how can we help them take responsibility and do something about it?
So they can move on from this
Exactly, and move on with their lives.
Okay, so how does trauma affect a person?
Okay, so the effects of trauma vary with the individual. But one thing that I've noticed, and usually I feel is the source of every other effect, is the unanswered questions that most people who have experienced trauma face. And this is from my own clinical experience. There's always that question that they have, unresolved conflict. Questions about why me, for example. What could I have done differently? What could I have done differently? So all these questions are questions that they've not been able to answer. And as long as these questions are there, it will lead to other other forms of responses. So let me give a good example. So a young lady gets raped, maybe at age 3, for example, and then this becomes consistent. And then the question of, why does it have to be me? So this young lady would say that every time I'm around, people want to take advantage of me. Why always me? That means there has to be something about me.
That's wrong.
That's wrong. And so rather than looking at the perpetrators, she is looking at herself as the problem. And some of them begin to see themselves develop what we call negative core beliefs about themselves by saying, I'm not good enough.
That's why this is
That's why this is happening to me. Maybe this is the way I can get people to love me because I'm inadequate. And now these thoughts, these cognitions, these core beliefs begin to affect other areas of their lives. So beyond the physical effects, the immediate physical effects. So, for example, for sexual trauma, which could be sexually transmitted diseases, unwanted pregnancy, you could have, other effects, depression, for example, anxiety. This could come as a result of, and even psychosis. Some people could develop psychosis. They could break down and have distortions, distorted thinkings, hallucinations, keep on hearing the voice of the person, or keep on smelling the voice of smelling the odor of this perpetrator. And this could lead to PTSD, as we talked about. It could also affect their relationship with God, because a lot of some victims might begin to say, if God truly loved me,
why did he let this happen?
Why did he let this happen? And so there's that relationship that is affected, the relationship between this individual and God. It could also affect their ability to socialize, because one, they don't feel adequate enough. And so when they're around people, there's that feeling of being less. And so they cannot socialize. It could also affect their marriages. It could affect their marriages and even affect parenting, their parenting ability as well. So it has a ripple effect, a very huge effect on the individual and even on the society. Because now, something that I've noticed is that a lot of people, permit me to be a little bit biased, the female gender, who blame other ladies for being abused, a lot of them now have experienced this.
So why are they the ones blaming others?
Because it's a way to psychologically deal with their own trauma.
But that's very unhealthy.
Of course, it's unhealthy. That's why it's a problem. Because they feel like, and you see this with parents, so some parents experience something traumatic growing up, either poverty or, and they don't want their kids to experience it. And because they don't want their kids to experience it, they become overprotective and affect every other areas of the child's growing up. So again, like I said, this could be have the right intention, right? It's my way of coping. If I want to deal with my traumatic experience, I want to shield my child from experiencing this. However, by trying to shield this person, you expose them. You might expose them, especially because you are affecting them psychologically, and then they get exposed to traumatic events or experiences, just like you have. Some parents don't even share their experiences because they are ashamed of it, and that's because they feel it's their fault.
Does it help when people actually share these experiences?
Yes, it does. It does help when you share experiences. One, because it helps the other person know that they are not alone. Right? It also helps the victim let go of the pent-up emotions, all the emotions they put in, let them out. It also helps them see it from a different perspective. So all this while I've been thinking it was my fault, but the moment I'm able to come to that place where I accept the experience and start to share the experience, it helps me begin to see it differently.
Okay.
Again, the disclaimer here is that you don't just ask everyone to go start sharing. They must come to that place of acceptance first, where they're able to accept that experience as this has happened. There's nothing I can do about it, but I can correct my life going forward.
But I feel like a lot of people are scared to open up about certain things because of how people react. People's attitude towards them might change because we don't know how to cope with these things in this part of the world.
Well, true.
Let's be honest.
True, actually. A lot of people keep it to themselves because they are afraid of how people will react to them. But I like to put this, that you should see yourself as more important. See yourself as more important than how people would see you. When it comes to your healing, you are key. Yes, people might have their opinion, but if you subject your life to being stagnant, fixated, because you feel that, people would have negative opinion or impression about you, then you're doing yourself injustice. True. In fact, a lot of times, people are waiting for you to speak up so that they can also share their experiences. So the way it works is that we're all looking for that person who will be brave enough, who will be courageous enough. I've also found that, a large percentage of the time, people don't even have any negative impression about you. But we think, and that's where the error is, we get absorbed in the fact that people might have this negative opinion. But a lot of times, and recently you've seen cases of people coming out to share their experiences and people standing behind them. And I've worked with a number of these people. So you get to see that it's not in you being afraid of what people will think, because a lot of times people don't even think anything negative about you. It's you thinking that they would think, and again, you are trying to read their minds, and that's an error.
Okay, so why is it so difficult to get over traumatic experiences?
So in my experience, it's because a lot of times when, permit me to go a little bit deep in psychology,
Sure.
there's something we call unresolved conflicts, right? And so when people experience trauma, it's, of course, the word there is trauma. It's a conflict. It's a conflict that usually stands maybe against their beliefs, their values. So their beliefs is, if you're good, for example, good things should happen to me. Unfortunately, something bad is happening, and they are not able to comprehend this. There's a particular part of the self called the ego, right? And that ego deals with reality. It's the knowledge-based part of us that is able to help us think through things and resolve them. At most age where people get abused or experience trauma, the ego is not developed enough to help them deal with these things. And so what the ego does is that the ego tries to bury the conflict. And this is what you would see. It's like killing a rat in a room. And because my girlfriend is coming over, I don't want her to know that there's a rat in my room. I'm a tush guy. And so I hide the rat under the carpet, right? So for that day, it will look like, oh, this guy is a very neat guy. But subsequently, when she comes to that room, something is smelling. And that's what really happens with trauma. So you experience it. You're not able to deal with it. You hide it under the what we call the unconscious mind. And then years later, months later, it begins to, but it doesn't come, just like the rat will not, manifest through the visuals. So you're not seeing the rat, but you're smelling it. These experiences don't come up like they happened. They come up in other areas of your life. It could affect the personality of the individual. It could come up with flashbacks, with different areas of affecting relationships, affecting jobs, and all that. And so it becomes difficult to even trace where it's coming from. For most of them, they don't know where it's coming from. And that's usually the problem.
Because it's been buried for so long.
Exactly. And so the biggest issue with trauma is the unresolved conflict that accompanies most traumatic experience.
Definitely to be the death of my father. I still can't forget, because it was a very good example to me.
When it happened, when my teammates wanted to take a particular project in which we were working together, and it was so uncalled for because the trust was being betrayed. And these were people I called brothers. So I guess that's a situation I cannot forget.
So what are some of these symptoms of trauma? And is it possible to overcome it?
Yes, it's very possible to overcome traumatic experiences. But then duration is what differs with people. And then the way you overcome it also differs with certain people. So yes, the symptoms could range, and I mentioned some of them already. Extreme sadness, depression, feeling of hopelessness, feeling of worthlessness, even suicidal tendencies, self-harm. Some people try to harm themselves, inflict injuries and pain on themselves just to drown that psychological pain that they're going through, but without the intention to commit suicide. Poor spiritual experiences as well. It affects spiritual experiences. Some people hate God today because of something that happened some years ago. It also affects the character and personality of these individuals. Some people are really mean today because they've had some painful experiences and they're trying to get back at somebody. They're trying to get back at the world. So yes, it ranges from even memory problems, concentration problems, problem at work. It could affect work. It could affect schoolwork, academics. It could affect relationships. Yes, again, the list is endless.
Okay, so I've seen it a lot in movies. You see the child who's a bully in school is probably going through a very chaotic home environment. Maybe our parents are going through a divorce or something. So is it possible can you tell us ways a person can overcome this trauma?
Yes. So the first recommendation I would give usually is to see a professional. If you've had an experience like this and then you feel this is affecting you, see a professional. Even if you don't feel it is affecting you, because most times when people experience trauma, there's that level of denial. They feel, no, I'm fine, I'm okay. And so if you've had a traumatic experience, see a professional, let them do an assessment and tell you what if you're fine or if you need to move on. Like I mentioned earlier, the brain can heal on its own, right? So it's when the brain is not able to heal, that's when you need help. However, other ways people can deal with trauma is to go back to these experiences, right? And look at the experiences from a more rational perspective. Now, when I mean rational, without bias, so a good example would be, so I mentioned the 3-year-old girl who has been abused,
Yes.
But keeps on thinking that it was her fault. So maybe let me turn the story around. And so she finds out that she keeps on going back to the abuser. And the question is, if I didn't like it, why am I going back there? But when she wants to, if you're going to help this person look at it more rationally, you need to understand that at 3-year-old, this girl doesn't have a developed cognitive system. So she's not able to process things as well as an adult would. In fact, most times what I've found is that it's their way of crying for help. I had a client who, when we were able to dig deep, we found out that the reason why she was going back because she was hoping that someone would find out. And if they find out, they're able to do
save
something
her
about
from the
exactly.
situation.
And she would say that, oh, that even when her mom is, trying to bait her, in her mind she's saying,
Why can't you
notice something is wrong? Do you get? So a lot of times it's going back to these experiences and trying to look at it more rationally. Trying to look at it rather than looking at it from, it's my fault, right? Because it's these unanswered questions. Why me? Is it my fault? Is there something about me? All these unanswered questions are actually what leads to the symptoms, the after effect of trauma for most people.
Okay, so is it possible to tell if someone close to you has experienced something traumatic without the person telling you?
Well, you might not know if they've experienced something traumatic, right? But you could tell that something is wrong,
Okay.
right? So let me play an example. You have a sister who always tries to date men that are not available. Married men, for example, or people who just are not available. And when she finds people who are actually available, she runs away from them. Then that will tell you something is wrong, because that's not normal. And that could be the result of a traumatic experience. That could be the result of something traumatic happening to this individual. And so the easiest way to identify people who might, because again, you can't tell for certain who would have, so is to take note of their behaviors, right? Take note of their behaviors. Take note of their personality. Some people get this anger outburst. Some time ago, now this is also a little bit funny, but some time ago, we saw something on social media where someone attended an interview, and then after leaving the interview, said something nice to the interviewer, and she got angry, right? A lot of people blamed her and said, why would you get angry? This person was just trying to
pay you a compliment.
Do you get it? But what they don't understand is that she's getting angry because that is touching something, an experience she has had before. And that's what we need to start looking out for. So when people act excessively in situations where they shouldn't, then it tells us that
there's something
here. There's something here. For some people, depending on how close you are to them, they could also express this in different ways. Something like slip of tongues. Some others would say free association. So you're talking with somebody and they just start, when you mention a certain topic, they start to feel a little bit distressed. So you can see them begin to sweat. You can see them begin to get really agitated. So that could tell you that, oh, this is something that might
touchy subject.
Be traumatic to this individual. You could also take notes in nightmares. This individual having recurrent nightmares, having flashbacks, having poor sleep, poor appetite. It could affect their relationships with other people as well. So when you notice things like this, and even lead to depression.
Okay, so how can you help someone who is experiencing trauma symptoms?
So just like every form of mental health, psychological distress, the best way to help people usually is to be there for them, right? Don't try to impose your ideas, because for most people who have experienced trauma, you would have that resistance. They will resist those ideas. And so you need to be able to understand them without judging. You don't have to, you need to come to a place where you can offer that empathy without judging them, because the biggest fear they have is that this person might judge me. If I share my experience, you would judge me. And so you just want to place yourself at that point where you can say, I'm here to help. Whatever you need, I'm here to help. And then if you can, refer this person to a professional, very importantly. For individuals who have been abused, I usually recommend journaling as one way to, we call it the storytelling, right? But you tell the story differently, right? So you want to tell the story in such a way that you have the power, rather than telling the story in such a way that you were the victim, right? So at first start, you might not be able to create that power ending kind of narrative, but tell the story, write the story, because just like I mentioned with the rats scenario, that the reasons why we struggle with this is because it's an unresolved conflict and we've buried it. And so what you're trying to do by telling that story is to unearth the rats, kind of, unearth that conflict. So storytelling, for most people who are probably creatives, doing poetry, artworks, could somehow help you express your pain, help you express these conflicts. And by expressing them, you are beginning to see them differently. And then by the time you start to do this, you start to change the narrative. You start to change the narrative more from a place of being a victim to a place of power.
Okay, thank you very much. That's all we have time for today.
Thank you for having me.
It's been a pleasure having you here.
It's always nice being here.
Trauma is something that should not be joked with. Honestly, it should not be joked with. Stop the victim blaming and just work with one another to help build a stronger and better version of everyone. And we can all do better if we only believe that we could. Before we leave you today, we're going for today's episode of Know Your Faith. Stay with us.
There is a famous story about St. Martin of Tours and how he cut his coat in half to share with a beggar who was freezing in the cold. Later that night, it was shown in a dream that the beggar was Jesus himself. Welcome to Know Your Faith series. My name is Judith. As you must have guessed, today we'll be talking about clothing the naked. Who in your judgment needs clothes? Those who cannot afford them? Those who you see wear the same clothes again and again? Charity demands that you share some of your clothes with them, especially those which you do not intend to wear again. First off, if you have clothes you've not worn in 6 months, give them out. Between the ashwabis, the seasonal wears, the clothes you bought because you had too much money, when do you think you will ever wear them again? The wise thing to do is to decongest your wardrobe. Give out these clothes and you will gain graces. 2. Learn simplicity in dressing. Most ladies fantasize about having a big closet. Yeah, looking good is good business. But the truth is, having more clothes means more difficulty when you're choosing what to wear. So keep it simple. Besides, it's a vice to dwell on vanity when others cannot afford the basic necessities. Other ways of practicing these precepts are: give old and unused clothes to a homeless shelter. Pray through St. Martin of Tours to help you to live a life of service to God. 3. Pray for the virtue of modesty in your dressing so that you give glory to God with whatever you wear. 4. Offer to mend clothes for a homeless shelter. Giving clothes to the poor during Lenten season is one of the good ways to fast if you don't want to fast from food. Let's be honest, I know it might be difficult, but then it is worth it if heaven is our goal. Let us know in the comment section of some ways you've been able to clothe the naked. Until next time, be bold, be Catholic.
Welcome back. That was Know Your Faith for today, and we've come to the end of our show. Thank you very much, Mr. Chris, for being here again. It's always a pleasure having you here.
Always a pleasure being here.
Thank you. For questions, suggestions, or if you just want to join the conversation, follow us and hit us up on our social media platforms at CFF on TV across board. Also subscribe to our YouTube channel at Dominican Media Presents on YouTube for this episode and other exciting episodes of the show. Till next time, keep being saints in jeans and shirts.